Good afternoon, everyone, and welcome to the COVID-19 update for Monday, December the 7th. Today marks the 18th day since our toughest statewide mitigations of the fall, Tier 3, took effect. And I'm hopeful that some of the recent early improvement in our trends will continue. But to be clear, the numbers still have a long way to go to move away from what could reasonably be called the danger zone. In other words, the surge on top of a surge that national experts have said might define the holiday season is still the focus of our attention. Statewide, approximately 3 in 4 of our staffed hospital beds are currently in use. That's not the kind of statistic anyone should hang their hat on while infections are rising nationally and states around us are running out of room in their hospitals. That's why it's more important than ever to stay masked and stay home. And let's remember that a surge in community transmission is a certain prelude to more lives lost. We're seeing it throughout the Midwest and the nation. Illinois is now averaging 152 deaths per day from COVID-19. That's an average 35 more individuals per day than the worst rate that we reached back in the spring. Each of these individuals, and over the last 24 hours, we lost 90 of them, survived for months during this pandemic. Some of them might have gotten tired and let their guard down. Others might have been trying their best to do all the right things and somehow, some way, still got infected in this horrible pandemic that's still ravaging our nation and taking more than 1,000 American lives in the last 24 hours. But even without knowing each of their pandemic stories, I can tell you this: most of those deaths were preventable if everyone would wear their masks. I can tell you they leave behind countless loved ones who are grieving lives stolen too soon. And I must ask you to please do everything in your power to save your loved ones from that same tragic loss. Focusing specifically on the state of Illinois, our case and test positivity average rates have remained around 10 and 12% respectively over the past week. This is a key indicator to let us know if we'll see a spike related to Thanksgiving. Statewide, we've seen a slight decline in people getting tested and in turn a slight decline in our positive cases, likely a result of an uptick of people seeking to get tested before Thanksgiving. So far, we haven't seen our positivity rate start to creep back up, which is a good sign. But we also haven't seen it substantially fall. Not a good sign. It may be that our mitigations are working to offset the expected surge in cases, but we won't know that for sure for at least 2 more weeks. As you know, COVID hospitalizations lag cases reported. In the most recent week, we've started to see a slight decrease in hospitalizations. And even with this downward movement, our COVID-19 hospitalization total statewide is still 14% higher than our spring peak. If you're wondering why that particular figure is important, if we're starting to see a downward trend, it's this. 14% higher than the spring means that our hospital's ability to handle another surge is tighter than it was last spring. It's likely too early for us to have yet seen the bulk of Thanksgiving-related hospitalizations yet. We're now in our 11th day since Thanksgiving, and we are 4 days out from Hanukkah and 18 days from Christmas, 19 days from Kwanzaa, 24 from New Year's Eve. These next 4 weeks may be the most crucial month of this entire pandemic. We quite literally have very limited leeway in our hospital systems to manage another surge. So mask up, keep your distance, and plan smaller, more intimate holidays this year. Let's give each other the greatest gift of all this holiday season, good health, and a bright future. Thank you, and now I'd like to introduce Dr. Ngozi Ezike from our Department of Public Health.
Good afternoon and happy Monday. As you have heard, the U.S. has entered a new phase of high-level COVID-19 transmission. Today in the state of Illinois, we are reporting 7,598 new diagnosed cases of COVID-19 for a total of 787,573 cases in Illinois. Sadly, news of an additional 90 deaths were received for a total of 13,343 lives lost here in Illinois. And of those deaths are included a teenager, an individual in their 20s, an individual in their 30s, as well as those in their 40s and 50s, as well as 60s and older. This is just another reminder that COVID doesn't just sicken and kill older adults, but can be a deadly disease at all ages. Overnight, 5,190 people were reported to be in the hospital with COVID-19, and of those, 1,123 were in the intensive care unit. 648 patients were on ventilators. In the last 24 hours, more than 77,500 tests were reported for a total of over 11.1 million tests in Illinois. But as we spend more time indoors because of the colder temperatures and as the holiday season continues, it's essential that we implement all of our public health strategies at both the community level and the individual level. And these critical evidence-based CDC recommendations and sustainable strategies to reduce COVID-19 transmission include universal face mask use, maintaining physical distance from others, and limiting in-person contacts, avoiding non-essential indoor spaces and crowded outdoor spaces, increasing testing to rapidly identify and isolate people who test positive, and quickly identifying, quarantining, and testing close contacts of the identified cases. The recommendations and strategies also include postponing travel. These actions, along with wide availability and high uptake of safe and effective vaccines, will help us return to our everyday activities much sooner. And a final note, this is National Influenza Vaccination Week. I highly recommend that everyone get their flu shot to help avoid a twin-demic. We know what we need to do, so let's just do it. Let's mask up, wash up, back up, and sleeve up for our flu shot. Thank you. Hola y buenas tardes. Los Estados Unidos ha entrado en una fase de transmisión de COVID-19 de alto nivel. Aquí en Illinois hoy informamos 8,691 nuevas personas diagnosticadas con COVID-19 para un total de más de 796,000 casos. Desafortunadamente, hoy se reportan 90 muertes para un total de más de 13,000 vidas perdidas en Illinois. Las muertes de hoy incluyen a un adolescente, un joven de 20 años y otro de 30 años, además de los de 40, 50, 60 años y más. Esto es un hecho evidente de que COVID-19 no solo enferma y mata a los adultos mayores. Puede ser una enfermedad mortal para cualquier edad. Desde anoche, 5,190 personas estaban en el hospital con COVID-19. De ellos, 1,123 pacientes estaban en la unidad de cuidados intensivos y 648 personas estaban en ventiladores. En las últimas 24 horas, más de 77,000 pruebas de COVID-19 fueron hechas para un total de más de 11.1 millones de pruebas en Illinois. A medida que pasamos más tiempo adentro, debido a las temperaturas más frías y las días festivas continúan, es esencial que implementemos todas nuestras estrategias de salud pública individualmente y como comunidad. Las recomendaciones fundamentales del CDC y las estrategias sostenibles para reducir la transmisión de COVID-19 incluyen uso de máscara, mantener la distancia física, limitar los contactos en persona, evitar espacios interiores no esenciales y espacios exteriores con mucha gente. También aumento de pruebas para identificar y aislar rápidamente a las personas que dan positivo. Identificar, poner en cuarentena y probar rápidamente contactos cercanos de casos. Posponer viajes. Todas estas acciones, junto con una amplia disponibilidad de vacunas seguras y efectivas, nos ayudarán a volver antes a actividades normales. Sabemos que tenemos que practicar los 3 M's, máscara, manos y mantener su distancia. Todos los días, todas las noches. Esta semana es la Semana Nacional de la Vacuna contra la Influenza. Por favor, si todavía no se han vacunado, háganlo hoy. Gracias por su apoyo. And with that, I will turn it over to Governor Pritzker.
Thank you. Before I take questions, I want to provide an update on the situation at our LaSalle Veterans Home. As of this morning, 39 of 96 residents have had their most recent test for COVID come back positive, along with 21 staff members. To date, we have sadly lost 32 residents at LaSalle to COVID-19. Earlier today, our Department of Veterans Affairs announced that IDVA Assistant Director Anthony Vaughn will be taking over as the interim LaSalle Home Administrator, effective immediately. The independent investigation into the actions of leadership and staff will continue, as will our work with the Federal Veterans Administration experts to ensure that all of our veterans' homes are fully in compliance with all required health and safety measures. We will do everything possible to safeguard the lives of our heroes. Let us make no mistake. These tragic losses serve as a stark and painful example of what happens when community spread is rampant. I mentioned earlier that the number of Illinoisans we're losing each day has surpassed our record from the spring. The same is true nationally. The United States is currently losing, on average, 1.5 American lives to COVID-19 every single minute. The loss of life at our LaSalle Veterans Home is heartbreaking, which is why I continue to use every resource at my disposal to stop the community spread that makes this virus so insidious. We have grieved for far too many of these fatal outbreaks in nursing homes in every corner of Illinois, not to mention in every corner of the nation. In LaSalle County, where positivity rates have been much higher than the state average, despite tight rules surrounding mitigations and testing, there are 3 homes with outbreaks that were more fatal than this one. Yes, this virus preys on the elderly, and it looks for a carrier to bring it inside a home, even when significant efforts are made to follow mitigations. But it should never have been this bad. For months now, I have fought so hard to make sure people understand the importance of wearing masks, the importance of reducing opportunities for transmission, the importance of local law enforcement following through on their mission to serve and protect by ensuring mitigations are followed. These actions might seem small to some, but applied collectively and consistently, they prevent tragedies like this. This is why I'm infuriated by those who oppose proven mitigations at every turn, but now profess belated concern. The worst case scenario that I have tried every day to prevent is now our reality in LaSalle. To all those who have lost someone they loved, I grieve with you for the time that was stolen from you. I grieve with you that the refrain of vaccines as a light at the end of the tunnel rings hollow to you, because a light has already left your life. And I promise you, I will not stop looking for ways that we can do more to save lives and protect our most vulnerable Illinoisans from this pandemic. And now I'll take questions from members of the media.
Governor, speaking of mitigations, you heard the story over the weekend, broke today. A popular restaurant on the north side, Ann Sather's, which is owned by an alderman here in Chicago, was caught with people inside. The statement from the alderman says, on a sporadic basis, we've allowed a very limited number of our regular diners to eat inside the restaurant while observing social distancing and mask wearing rules. This was an error in judgment and won't happen again. What's your reaction to that?
Well, I agree it was an error in judgment. I also will say that elected officials should be setting an example, not creating the example that people may follow that will spread coronavirus. We have mitigations in place for a reason. We have asked everybody to follow them, and frankly, most restaurants and bars have followed them. They're doing the right thing. So I just, I think that the alderman has said properly that it was an error in judgment, and I think it was a tremendous one.
Is it frustrating to you, though, as you try to impose these mitigations and enforce these mitigations, it leads to an impression that there's a double standard out there? That's what we heard time and again in talking to customers walking by today. What do you say about that?
Yeah, the double standard is the people out there that think that they don't need to follow the rules. Those people out there have chosen, literally, to provide opportunities for people to get sick. The many, many good bar owners and restaurant owners who are suffering through this pandemic, and many other businesses, but let's talk about bar and restaurant owners. They're suffering tremendously. This is through no fault of their own. This virus wants to get transmitted in a place where people take off their masks for an extended period of time, sit across from one another, eating and drinking, and that's exactly an amplification point for transmission of the virus. I feel terrible for the law-abiding bar and restaurant owners, that there are others out there that are trying to take advantage of the public and get them sick. And so, look, I think that I suppose there'll be ultimate judgment on those people. But in the interim, the fact is that anybody that took any business interruption grants that is not following the law will have those taken away from them. And I think all of us will remember who was protecting us, which business owners and businesses and bar owners were protecting us. When we get past this pandemic, I think that the people who were not protecting us will be held accountable by the patrons who live in their area.
What should the consequence be for the alderman? Or is it...
Well, look, I have said all along that folks need to follow these mitigations, and I think the alderman ultimately, as you know, we put in place rules where if you get warned, you have an opportunity to correct it. There's a potential for a dispersal order, and then finally there could be an imposition of a fine, for example. And so all I can say is I don't know the circumstance of how many times this happened or whether he was warned. All I know is he ended up in the right place, but like I said, he absolutely is responsible for an error in judgment here.
Governor, regarding LaSalle, just further comment on the change in leadership. Is this an acknowledgement or a statement that leadership failed those residents? What responsibility do those individuals bear?
Well, I guess I would say, there's an investigation that's still ongoing. We need to make sure that we know exactly what happened. What I know is that our job right now is to make sure that we do everything to protect the people who are at the LaSalle Veterans Home. We've been trying to do that all along. This is another step to make sure, I mean, since the moment that we found out there was an outbreak, there's been a lot of effort that's been made to evaluate the problems at the home and to mitigate those problems. This is another way for us to keep the people at that home safe.
Do you think the stay-home messaging is still effective?
Yeah, remember, we do not have a stay-at-home order in the state of Illinois, right? We have a Tier 3 set of mitigations, which are significant, and they are having, I believe, an effect. I mean, we have seen that while the rest of the country is rising in terms of their positivity rates, in terms of the number of cases, in terms of their hospitalizations, ours have been moderating, let's say. They're still high. They're still high. But yeah, I think more and more people, certainly seeing the massive wave of coronavirus that's hit virtually every state now, I think people are taking a step back and saying, maybe I need to really pay attention to all these rules, and especially around the holiday time when I think all of us want to keep our relatives safe.
We'll do one more in the room.
A question on behalf of my colleague Elizabeth Matthews. She's asking about the new outreach campaign for Latino and immigrant communities which face high COVID rates. What will that campaign include, and why is it so important?
Well, I can't tell you exactly what the art or the presentation is. I mean, I've seen some mock-ups of what the state is doing, but it's very important to communicate in our communities of color, where there is a higher incidence of contracting COVID and a higher death rate. And so it's very important that we get the message out to people maybe who haven't been following the mitigations, either for lack of understanding them or some other reason, that now more than ever, in this worst of times during the pandemic, now is the time to double and triple down on these. Pay close attention, keep your family and neighbors safe. So, look, it's vitally important. We need to make sure the messaging is out there. People are reminded. I know people have gotten tired. Some people have gotten tired. All of us experiencing this for so long. And so just a reminder to everybody, vaccines are on the way, but it's going to be months before, most people in Illinois will have been able to get a vaccine. And so just hang in there. Please wear your mask, keep your distance, follow the mitigations. That's what the messaging ultimately is going to be all about, and especially to those communities that have been most badly affected by coronavirus.
When do you
Eric?
anticipate, Governor, you're saying it's too early to know the post-Thanksgiving impact. When do you think, perhaps later this week, would be a good indication of where we are post-Thanksgiving, or is it going to be longer?
I probably should let a doctor answer this, but I'll just say that, we've always focused on, 1 to 2 incubation periods as a way to measure how big the surge would be. We're kind of a week and a half, 2 weeks into this, maybe two and a half weeks now. So, there's time still to watch. I called one of the great epidemiologists, great infectious disease doctors just over the weekend to get, feedback about the timing, right? Because the numbers looked like they're getting better, and I wanted to know what their impression was. And their impression was, we haven't seen the hospitalizations yet that would come from Thanksgiving, that they're encouraged that the numbers are abating right now, but that's a good thing because we might need that space in the hospitals if the surge is still happening. So we're still watching and waiting. But I don't know, Doctor, do you have anything else you like that? Yeah.
So again, I would say that timing is everything, as the governor has stated, and it's still early. So anything that we're seeing in terms of flattening is a result of other activities, but in terms of the surge that might be anticipated associated with Thanksgiving, remember that it's not just the day Thursday, that usually it was a whole weekend event. We know that the big travel days would be before the Thanksgiving and then also that Sunday. And so I think I'm using that Sunday day saying that we're really only a week out, and so it's really early. We might be seeing a few increased cases compared to the previous days, but we don't like to follow a day or two. We like to see trends. But definitely, the end of this week and next week, we will really kind of get a better handle. Cases. Remember, there's a timeline. The cases happen first. It's not that people just end up in the hospital all of a sudden. You see the spike in the hospitalizations. You'll see the increase in the cases first. That will then be followed by the hospitalizations, because we know a certain percent of those might end up in the hospital. So we still need more time. It's too early to say. We will know more at the end of this week. That'll be 2 weeks out, and then for sure, maybe in that third week, we can see what's happening and see the extent of the rise.
All right. Kelsey Landis at the Belleville News-Democrat. When local officials refuse to enforce executive orders and state's attorneys refuse to prosecute ISP citations, will the state revoke or suspend liquor licenses? If so, at what point?
So as you know, the laws around liquor license removal, something that allows a bar or restaurant owner to go through a long series of appeals and so on. So it is possible to have those removed. It's just a much longer period of time than I think any of us would like. It can be done and should be done at the local level. The local liquor commission or local liquor commissioner has the ability to do that and should do that, because people are breaking the law when they have indoor service at a bar or a restaurant.
Jim Haggerty at the Rockford Advocate. Dr. Zike, are hospitals seeing patients who are stricken with the flu and COVID-19? And if so, how are doctors treating those patients?
We have had some reports of co-infection, but we're not anywhere near the peak of flu season. And the good news should be that as people continue to wear their masks, we should see fewer flu hospitalizations than we have in previous years, because we never wore masks during the flu season. So we're hoping that that benefit of the mask will definitely extend to the flu hospitalizations as well. So keep wearing that mask. We're accomplishing many good things in terms of cutting down infectious transmission.
John O'Connor at the AP. Why not distribute vaccine based on hospitalization rates? Champaign, Sangamon, Peoria aren't in the top 50 counties, but are where the sick people get treated. Will regional site staff get vaccinated even if they are not in the 50 top counties?
There are a variety of pieces of that I'd like to respond to, but I guess, in fact, I'd like to call on Dr. Ezike just to answer, I think, most of those items, but I'll come back.
If I could just level set by explaining that there are so many moving parts, and no matter what plan that we put forth, there's going to be holes that will be poked in it, and there is no perfect plan. At the beginning, when we created the criteria for just the initial allotment, remember that we are not going to have enough vaccine for all the people that are in 1A. So even the people who are supposed to be at that highest priority, they could go past day 1, past week 1, past week 2, week 3, and still have not gotten their vaccine. Everyone cannot get it on that first day. So in trying to just come up with a plan, and remember also, as the CDC has been changing their guidance, when we initially came forth with our plan, we thought that first responders and hospital and healthcare workers were the priority. The plan was put in place, and then we found out at the meeting that happened last week that actually we're going to do long-term care and put them in 1A. But the initial plan that we had in place is that we were going to use the top counties that have suffered the most with COVID. And I think that most people would agree that a proxy for seeing the most suffering in a county would be the most deaths in that county, and not trying to discriminate against counties that might be smaller, so their number of deaths would look insignificant compared to larger populated counties. We did it by capita so we could account for size. So we put the top 50 counties with their death per capita and said we'll start there, knowing we're still going to have to vaccinate all these other people, but this is just for week 1, for those 86,000 doses. And then again, there was no looking ahead to see what would this mean. It just, this sounds like a fair metric. We identified the 50 counties, and then we said, oh, wow, some of these counties don't actually have a hospital, but of course they would have first responders. This was before the ACIP guidance now put the long-term care facility residents there. So now if we have a plan to address the long-term care facilities for week 2, 3, and 4, but for week 1, that is supposed to be the healthcare workers, we want to focus, we want to keep the counties that we talked about, but if you don't have a hospital in that region, and if we're not supposed to be doing a non-healthcare first responders first, then we will, again, we've had wonderful conversations with numbers of stakeholders, dozens and dozens of stakeholders who, as we presented this plan, the goal was to solicit feedback, and they gave that feedback of, are there other ways? And so we're trying to, use all of that helpful feedback. So definitely, if there's a county that doesn't have a hospital, we can, because we're focusing on people within that hospital system right now, we can identify the hospitals for that county which their residents actually go to. And we can include, the hubs that are going to be distributing this. So again, please allow us to continue to do this work that's constantly in progress. We're constantly trying to tweak and adjust to get a better and better plan. We appreciate the input. And even between now and when vaccines come, there may be additional tweaks. And I hope that you allow us to continue to do our work. We'll continue to share what we're thinking and accept your helpful feedback.
I'll just add one thing let me add one thing. Remember that by virtue of what we've seen so far from the CDC, we are likely to see hundreds of thousands of doses coming to Illinois during the month of December. So the very first set, what is understood to be the smallest first delivery, the 109,000 going to those 50 counties with the highest deaths per capita, is just the very first segment. That the vast majority of what will occur in the month of December will go to what is deemed to be 1A. Those are healthcare workers all across the state, not just in those 50 counties. Healthcare workers all across the state, plus long-term care facilities.
Amy Jacobson, last week, IDPH released a list of potential exposure sites. Factories and hospitals were at the top of the list. Restaurants and bars were 10th on the list. And gym and youth sports weren't even on it. With this new science, will you roll back the restrictions?
Well, let me begin by saying those are not potential exposure sites. Those are actual exposure sites, number one. Number two, the reason that bars and restaurants are not near the top of that, as they have been for so much time before, is because we've shut down indoor bar and restaurant service for weeks and weeks now. So guess what? When people are interviewed in their contact tracing calls about where their exposure sites were, where they were, they're much, much less likely to say a bar or a restaurant.
Dave Dahl, WTAX. Speaker Madigan was quoted over the weekend as saying something about helping you get an income tax increase in light of the failure of the graduated tax proposal. What is he talking about?
Well, what I can say is that I'm focused on the cuts that need to be made in state government, making sure that we're paring back as best we can, making efficiencies in state government, looking to Republican and Democratic leaders, as I already have, and asking them for their best ideas about what it is that we need to cut in state government. So that's what I've been focused on, and I will say that I have not yet heard back from the leaders about what their best proposals are for what cuts need to be made, and so I'm awaiting their responses.
Jim Leach at WMAY. Any reaction to Rep. Halbrook's 100-person indoor gathering this week, which he says is protected under the U.S. Constitution?
Well, I'm not sure how to address the protected by the U.S. Constitution other than to point to all of the cases that have been lost by the snake oil salesmen that have been running around to courts and filing complaints on behalf of people like Rep. Halbrook. And then I would just say shame on him. Shame on him for having people in a room packed together, not wearing a mask. He knows better. He should know better. If he doesn't, maybe he shouldn't be in the General Assembly.
Why do
Joel,
you take a harder line with him than with Toomey?
No, I took a hard line with both. At least, I'll tell you what the difference is, by the way. The Alderman admitted that he shouldn't have done
I'm sure he
it.
got caught.
He admitted that he hadn't done it. Okay, but Brad Halbrook, he's been caught. You think he's admitting it? No. You think he's taking any responsibility? He has 100 people together in a space. He knows so much better than that. And the alderman does, and I just said it moments ago. He at least the words came out of his own mouth. The alderman said it himself. You don't hear Rep. Halbrook saying that.
Joel Ebert at the Daily Line. Voter turnout this year was nearly 73%, which is the highest for Illinois in a presidential election since 1992. With more than 2 million vote-by-mail ballots, would you support legislation to continue expanded access to vote-by-mail in post-pandemic elections?
Yes.
Dean Olson at the SJR. Will patients who receive the COVID-19 vaccine be charged, and will healthcare workers or others be required to get COVID-19 shots?
I'm sorry, will patients who get it be charged?
Yes.
No, the federal government is providing the vaccines for free, and there is potentially a fee depending upon whether you're insured or not insured, whether you have Medicaid or don't. But we are making sure that we are covering everybody. I think we all agree that even people who don't have insurance and don't have Medicaid need to get vaccinated even if they can't afford that fee. So let's make sure that everybody in Illinois has the ability to get a free vaccine.
Marnie Pike at the Daily Herald will be our last question. How and why were the 10 hospitals chosen to receive the vaccine? I think she means the regional health care.
Yeah. Sorry, that was who was that?
Marnie Pike.
Marnie. Marnie, those are 10 hospitals that have been identified prior to the pandemic, in fact, as regional health centers that work with the Illinois Department of Public Health.
All right. Thanks, everyone.
Thank you.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.